Well, let's, at 12 minutes past 7, turn to Niall Dickson, the Chief Executive of the NHS Confederation. They represent, well, the whole range of organisations that commission and provide NHS care as well. Morning to you, Niall Dickson.
Good morning.
Just a thought first of all about PPE before we turn to wider matters. When you listen to what Tom Fielding has just been saying and both sides of the argument, as it were, the government saying that this is something that is useful and is meant to be helpful to people, the unions involved saying it isn't and it's worrying, to put it mildly. What do you think is going on?
Well, I think the worrying situation is absolutely there. The reality is that there is a chance, and I don't think it's definite, but there is a chance that hospitals could run out, or indeed other parts of the system, could run out of the gowns which are required to treat some, not all, COVID patients. And that means that they have had to issue this guidance to make clear that if somebody is in that position, here is the fallback, which they point out, the World Health Organization and the Center for Communicable Diseases in the US have said this is what you should do in that situation. But of course, it's much less than satisfactory. And I think the fear around this is the big issue, and the fear and lack of confidence. I think there was initially quite a lot of fear and lack of confidence in PPE generally. I think that was restored a bit by the new guidance that came in, and by improvements in supplies to hospitals, but also to GPs and to social care and other parts of the system. I fear this may have pushed us back again, because the reality is that they are facing literally deliveries of gowns on a day-to-day basis, and people not quite receiving the numbers that they thought, enough perhaps to get through the next 24 hours, but again, the anxiety is that they're going to run out again. So I think within the service, there will be a lot of concern around this. We have to hope that they are able to access gowns from around the world. I understand Britain is not alone in this. It is an issue. We had planned for a flu epidemic, not for this particular kind of virus. So gowns in particular are a problem, because our stockpile had gowns, but nothing of the numbers we need.
Interesting you say Britain. I mean, actually in Wales and in Scotland, as I understand it, the advice hasn't changed. In other words, they don't think that they're running out.
Well, I understand the four nations are working very much together, and that there's a lot of mutual aid going around to make sure that wherever you are, irrespective of what part of the UK you're in, you will get supplies. So I imagine that this kind of guidance will be required everywhere if there's any danger that places might run out.
A wider point, which originally we were intending to talk to you about, but it's so important, that the effect of all of this on the NHS and on social care and on the links between the two, but the kind of wider picture, Neil.
Well, I think the first thing to say is that there are places where they're under enormous pressure at the moment, but there are also other places within the NHS, it is a vast system, where at the moment they're still almost bracing themselves for a surge. And of course, they've got to see if this plateaus out, as we hope it will. They've got to start thinking about how do you move into, people don't like the word recovery at the moment, funnily enough, in the NHS, in this sense, because recovery implies you're going back to where you were. And actually what people are talking about is, first, we've got to rethink our clinical priorities. We've got to adjust for that lower peak, which means we've got to start treating people that we weren't treating because we were bracing ourselves for this massive influx of COVID patients. So there will be patients who don't absolutely need an operation, for example, tomorrow, but it is important that they are treated. So there are those kind of people. The screening that we're not doing at the moment. Locking the system down and moving to COVID is not a free good. It has collateral damage. And as soon as possible, we want to try and get back to not normal, because the new normal will be a different kind of health service. And that's the really positive bit, because there's been a fantastic amount of energy. It's not just remote working. We are seeing an awful lot of, obviously, remote consultations. but links with care homes, new services that are being provided, mental health patients being properly screened, not having to go to accident and emergency department. There's one innovation after another, and the common phrase we get from our members is, innovations that took us months and years are now taking us literally a matter of days, and we need to capture those for the way forward.
Niall Dickson, Chief Executive of the NHS Confederation. Thank you very much.